And the second thing I want to talk about is the Crisis Pregnancy Center funding. If I may, Mr. Speaker, I want to read a insert or a policy statement from the American Public Health Association, which is entitled Regulating Disclosure of Services and Sponsorship of Crisis Pregnancy Centers. And it reads in part, crisis pregnancy centers are largely religiously affiliated centers whose primary promise is to prevent women who are experiencing unintended pregnancy from seeking abortions by purporting to counsel women on their pregnancy options. Women who contact and visit these centers have reportedly been presented with inaccurate information that is beyond the scope of the counselor's training and is clouded with biased alternatives and suggestions. While in theory, the purpose of CPCs seem genuine, evidence suggests that the centers use deceptive tactics to advance hidden anti-abortion agendas. CPCs frequently target women who are young, members of minority groups, or financially disadvantaged, and multiple investigations have found that CPCs often engage in techniques that are coercive, threatening, misleading, and aggressive towards these vulnerable groups. State and federal governments regularly appropriate public funds to support CPCs. Federal, state, and local governments have a special responsibility to ensure that taxpayer resources are not used to mislead and misinform persons seeking constitutionally protected and legal health services. The American Public Health Association supports safeguards to women's right to reproductive choice and opposes coercion in family planning and decision-making process. The reason I wanted to read that to you, one, is because the American Public Health Association is a highly regarded large organization that talks about the public health of people throughout the country and the world. But I really wanted to talk about that because I wrote those words. My master's thesis was on discovering the issues with crisis pregnancy centers in Ohio. And through my research, I found how deceptive, how coercive, how aggressive, and quite unfortunate these centers are. And the mere fact that we are not only appropriating money to them, but increasing appropriation to them, I think is a complete dereliction of duty and something we should not have done. The American Public Health Association, a national organization, took a stance in November 2011 based on my work that I did as a graduate student, and took this stance and asked federal, state, and local governments not to appropriate money to these centers because they don't deserve the money. The people who do deserve the money, the Department of Health, local organizations that are working towards maternal health, maternal mortality, as well as infant mortality. But crisis pregnancy centers do not do that work. They have not been proven to do that, and in fact, studies have showed that they do the exact opposite. And I think it is very unfortunate that we would want to do this and waste taxpayer resources with these deceptive, coercive, aggressive organizations. So as I close, Mr. Speaker and members of the Ohio House of Representatives, I am going to make a request to our governor to veto a few provisions in this budget. There are a few pieces of unfinished business that I think that Governor DeWine could work on that would make this even better. First would be line item vetoing the Crisis Pregnancy Center funding. They don't deserve it. They are deceptive, coercive, and aggressive.